Professor Joe Onigbinde, an infectious disease specialist and executive medical director, Roheka Medical and Dental Hospital, is here in the studio to talk to us more on this. Good morning, Prof.
Good morning.
Thank you for joining us on TVC Breakfast. Now, many have argued that the chances of the virus reaching Nigeria are small, especially because of the partial lockdown in China. But talk to us about the risks of this coronavirus getting into Nigeria.
Well, I don't think, I want to disagree with that. That is, the chances of getting to Nigeria is very, very low. I don't think so. Despite the lockdown you have in China, you still have a lot of Nigerians that are traveling to China, doing businesses and so. So they can import it, as it were, to the country. So I don't think we should let down our guards. If we have not had any preparation, it is time we started it, because the world is a global village now, so anything can happen. So I think we need to step up our surveillance system. I'm happy to hear that since I've been done at the airports and our seaports to checkmate this influx of or this importation of coronavirus, because coronavirus is very wide. It could be as simple as common cold, it can easily spread. Okay. So I don't think we should.
All right, so are the measures enough? Because it brings back to mind the Ebola case.
Oh, yes.
Despite everything that we put in place,
yes,
it still got into Nigeria. But are these measures enough that the government has put in place?
No, we didn't put any measure in place before it got to Nigeria. That's in Ebola. Ebola had actually entered before we started doing this fire brigade approach, which Nigeria is very, very, we are known for that. We are not always prepared until we have the case on our hands. And that is always the bane of our development, especially health in Nigeria. We don't put our structures in place. Our structures are very weak. And that is why most of the time we are caught napping. So I think, I don't know how much. I read a few things from the Center for Disease Control, yes, Nigeria. This government is doing some things quite positive. But I think that when it comes to health issues, we should not leave everything to government. All over the world, health care is not government's property only. Everybody has to participate. I've said that several times here, that we need something like called PPP, that is public-private partnership. Yes, we should have developed a lot of research centers. Like coronavirus does not have
any vaccine
at the moment. Yes, and other diseases like that, Lassa fever. These are the things that we should have actually been doing something about before they actually come on us. So I don't know how far government has gone. Okay. Here,
talking about Lassa fever, we see the number of deaths we have recorded early this year, and it is concerning for a lot of persons.
Of course,
that
absolutely.
We have been dealing with this issue for about 51 years, yet we are still struggling to find a headway to deal with this.
That is true. That's the problem we've always said. In health issues in Nigeria are not usually taken very seriously. We have relegated health issues to the background. Otherwise, since 1969, by now we should have something positive to get and to develop a vaccine to Lassa fever. We had the same problem in 2018. It was very serious, and we're still having the same problem right now. Lassa fever it shouldn't be a thing that will get us down. That's
the way it is now.
Yes, the way it is, if we have done the right thing. One of the critical issues is environmental health. Environmental health is very, very crucial to the spread of Lassa fever. Like you know, it's caused by all these rodents and so on. And go everywhere, you see slums, you see people digging holes, you see people,
bush burning as well.
Bush burning, and people even rearing animals within residential communities. Who shouldn't be so?
Really?
Yes. Oh, yes. I don't want to give you personal. At least I am unfortunate. We are so much. We had in our hospital
Yeah.
around that area. You see people that are rearing animals because of poverty. You see, people want to cut corners and so on.
This palpable fear, even across Nigeria, across the world, concerning coronavirus. And we see the effort that China is making, talking about building a hospital in 6 days. And the question has, on the lips of some Nigerians is, if this gets into Nigeria, when you look at our health security, do we have that strength, that might to actually challenge this just as we did in Ebola? Can we muster the same effort to deal with this?
Thank you. Let me first of all correct you. It's not Roheka, it's Roheka.
Roheka. Okay.
All right.
That is God is the doctor.
Okay.
Yeah. Well, can we marshal enough efforts to tackle
This.
coronavirus just as we did in Ebola? Well, I wouldn't even agree with you that we had enough efforts to tackle Ebola. We were just fortunate that it didn't have a wide spread at that time.
We're able to contain it.
Oh, yeah, we were able to contain it. And possibly because the doctors were on strike. If Mr.
Peter Sawyer?
Mr. Macaulay was his name.
Sawyer.
Mr. Sawyer.
Yeah.
If he had gone to a public hospital like Luth, we might probably still be battling with Ebola because we don't have enough strong structures, health structures in place. In fact, even the structure that was converted to Ebola was donated to us by Bill Gates Foundation for something else. So we just adapted it to Ebola. So we're lucky. So as we speak now, a lot of our structures are still very weak, and we are not doing so much about it. And when you have weak health structures, you will be caught napping anytime. So I don't pray that we'll have a great emergency in a coronavirus. Coronavirus is it's banal, as it were. We have the cause symptoms that are very simple to very complex situation. So what we are saying in essence that the government and the non-governmental organizations should begin to do something about it. We don't have vaccines for it right now, but we'll still do some research to see at least to be to
because in the short term, this is here now.
Yeah.
In the short term that we have, what would you expect the government to do to quickly put things in place and check the spread in case it gets into the country?
You see, I would not say the government should start to build structures right now, but I think the first thing that we should do, and it's not only the government, but non-government organization, is to cultivate the community, because it is everywhere. It can be everywhere. So to cultivate the community, that in case we have it right now, what are the things we can do to prevent the widespread and the control? I think that is what you should be doing now. The information. We don't have information, and that's a problem with a nation. In all those some American population they even have more information about some disease than even the medical doctor.
Okay.
So what I think the doctors the government should be doing right now is to see how we can sensitize the people. These are the signs you see in somebody who likely has Ebola, coronavirus.
Yeah.
This is what you should do, all these preventive measures. So prevention is always cheaper. It is cheaper than cure.
Right. Yes.
Thank you. Good morning.
Good morning.
Right, Nigeria has sent an advisory telling travelers, of course, businessmen go to China to be careful. But is that enough? How careful can one be?
Well, that is not enough. That may not be enough. But at least it's a starting point. But there are still a lot more to be done.
But we see other countries like we see in France, where they are even airlifting their citizens from China, and we see other countries also saying that, you know what, you cannot travel to China.
So do we stop
should we also look in that direction, stopping persons from traveling to China, and perhaps putting, if we have our citizens there, asking asking that the embassy there to take charge of those ones there?
Yeah, I think that will be a proper thing to do, but can we do it?
Can we?
Yes, that is the question I want to ask. Can we do it? We could do that, especially when you're talking about the embassies over there to take care of Nigerian citizens. It's a proper thing to do, but I doubt it if you have the will to do it.
Is it about the will or the personnel?
Well, we don't have the personnel. Even if we have the will, I don't think we have the personnel to do that. Look, China is a very vast country, and we have so many Nigerians scattered all over. And to be able to gather them to do all this will be a bit difficult. I mean, it's a tall order. That's my own opinion. I think there are other things we could do.
Okay.
That might be less laborious, less costly. Like I said, if you give them the proper, the first one, avoid getting in touch with people who are sick or who appear to be sick. But the problem again with coronavirus is that it has also been discovered that it can be transmitted even before manifestation, even where you still have the incubation. That is the difficulty. So I think we should just join the world to find solution to coronavirus, which is a tall order, I want to say. But I think we can still do something. That's in terms of vaccine.
Nigeria now.
Nigeria, yes. Nigeria.
Because the question would be that we are yet to come up with a vaccine that will tackle Lassa fever.
Even Lassa fever,
and then we are talking about coronavirus.
Coronavirus
Isn't that a tall order on itself for Nigeria?
Yeah, that's a taller order. It's a taller, but we have to start from somewhere. We have to start from somewhere. Like I said, we cultivate our people, both here and abroad, like in our embassies over there. There's nothing wrong in giving them flyers and so on, but this is what you should do, this is what you should not do in order not to contact this coronavirus.
But we still have people coming into the country. So if we don't have a situation where we can either airlift our people from China into Nigeria or stop travels to China and from China into Nigeria, doesn't it put us at a precarious situation?
That if you don't bring them back.
Yes, if we don't have measures.
If we're not putting measures in terms of no moving, you can travel
absolutely.
To China.
You need it. Both at the airport, at seaports, and over there, we need to caution our people. We need to check. We need to test them. Although the problem I said is that sometimes you can even still transmit this coronavirus without symptoms and signs.
Wow, and that makes it challenging.
Very difficult.
Professor Joe Onigbinde, thank you for your time on TVC Breakfast.